how will he go forward in life when we as parents are not here? Will there be support available for him? That's the biggest worry we have, Will he have a fulfilled life? I'm from Sweden. I'm here with my son who is 6 years old and have autism. He's nonverbal and he has stimming. So, I started reading like a lot of research articles, anything I could find. That's when we first started looking into stem cell therapy for not treatment, but the easing up of symptoms of autism. If it will help his life just 5-10% to make it better, that's a win in our column. Other than that, it's only money that can be lost. Money can always be made. If there's a chance of your child to have a 5-10% better chance at life or experience life in a better way, it's definitely worth it, in my opinion.
Hello, can you introduce yourself? Where are you from and what is your child's diagnosis?
Hello, my name is Ronny. I'm from Sweden. I'm here with my son Eric, who is 6 years old and have autism.
When was your child diagnosed and what symptoms or difficulties affected your child's everyday life?
He was diagnosed already at the age of 2, if I'm not completely off. And the challenge we have currently is, of course, he's nonverbal. And he's diagnosed with autism type 2. So that means he's nonverbal and he has stimming as well, and it can revolve around a lot of things. It could be anything from spinning around, flapping with his hands, and so on. He's also currently in diapers still as well, so that's a big factor as well. And of course, it's communication in general that is a big issue. What does he want to eat? Does he feel pain? How does he feel? Is he happy? Is he sad? Will he ever develop a communication with other children as well?
Can you tell us, if you can, what was the most difficult moment in your life regarding his diagnosis?
How will he go forward in life when we as parents are not here? Will he have the support that is available? Will there be support available for him in our country, in Sweden? That's the biggest worry we have, Will he have a fulfilled life?
Did you try any therapies or treatments before coming here?
We are enrolled in not really a treatment, but they call it habilitation, where the government in Sweden will give you some minimal assistance and help you go forward in life with, how can you maybe help him develop certain understandings and so on, certain communications. We got, for example, a tablet with pictogram on it, so he can build sentences that way. It has been somewhat successful, but not to the extent that would be preferred, of course.
And what was the deciding factor for choosing stem cell therapy?
To be honest, I don't really know. Because it's so far out to the right, because it's not very heavily researched, I would say, like in Sweden, for example, it's not very talked about as well. So we actually found out about it via a dentist of mine, family dentist, yeah.
That's the first.
Yeah, one of their friends had actually been to this clinic as well. So that's why they actually recommended it. That's when we first started looking into stem cell therapy for not treatment, but the easing up of symptoms of autism to see if it could help him in any way.
Yes.
So, I started reading like a lot of research articles, anything I could find, looking for Facebook groups that was revolving autism and stem cell treatments to see what the experience was for other families and parents and patients. And then we were like, the only thing we can actually lose is money, nothing else. Absolutely nothing else can be lost from it. You can maybe, because during the research we did, me and my wife, we saw that the treatment is extremely individual. So, depending how the results will go is extremely individual. There's no, 100% success rate for every patient. There's no just such thing. So, and then we came to the conclusion, if it will help his life just 5-10% to make it better, that's a win in our column. Other than that, it's only money that can be lost. Money can always be made.
I understand. Okay, can you tell us about your experience with Swiss Medica? How do you like the facility, the staff, Serbia at all?
With the communication with Swiss Medica has been very good. At first we weren't sure, you know, since it's in a foreign country, you don't really know. I guess that's a little bit on our side. We could have asked for a bit more details, maybe talk to another patient that has been here or similar, but we didn't do that. But other than that, it has actually been great. The clinic here where we are right now, the new building, which opened up now in October, I think it was. It's very nice. It's brand new. It's very clean. It's good. The food here is great. And if we had any concerns regarding the food, we could always ask the staff to make us something special. Like my wife can't handle dairy protein, so we asked the staff like, "Hey, can you make this one, but remove the dairy protein?" And they would do it for us. So it was very nice. And also Serbia is very nice as well, you know. We have been into the town a couple of times now to walk around and look and go to a shopping mall, also walk out in the parks. And it's now February, so it's not the warmest, but it's still very nice.
Can you tell us what are your long-term expectations for results from this treatment?
Yeah, that's a very good one actually. Of course, we would be super happy if he would actually develop more communication. That's a huge thing for us, to be better able to understand him and him feeling that he can make himself understood better. That's a huge thing. But also towards hygiene more as well, go to the toilet, be able to hold himself as well. Maybe stop using a diaper as well, since he's currently using a diaper as well. That's the two main ones. And if he starts to communicate, for us it doesn't really matter if he's using a pictogram or a tablet to use it, or if he starts to develop in speech. That would be actually, the Hail Mary of everything,
Did you see any improvements or something different in his behavior since he get the treatment?
I think I've seen a little bit more alertness, a bit more aware when we're requesting stuff. But he has also already starting to show simple indication that he needs a diaper change. And he's like more willing to do so. We have also conquered a fear of needle to a certain degree as well. The first day coming here, getting blood samples, it was extremely scary for him and also for us as parents. But now he is like not afraid to go into the procedure room anymore. He's willing to do it. The first 2 days he would be like start to scream and be crying that he doesn't want to go in there, but now it has relieved a lot.
Can you tell me, for the last question, what would you say for other parents considering stem cell therapy for their child?
As I said, the only thing you can lose is money. That's the absolute biggest thing. If you have the availability and the funds to do so, you should really consider it, because the only thing you can lose is money. You don't lose anything else. If there's a chance of your child to have a 5 to 10% better chance at life or experience life in a better way, it's definitely worth it, in my opinion.
Thank you very much.
Thank you.